Electronic medical records or electronic health records were introduced into the practice of medicine to much fanfare a few decades ago. A lot of time has passed since. We've had a lot of experience with those applications. I think nowadays many people are having second thoughts about electronic medical records. Why are people having second thoughts about electronic medical records? Let's take a look at the advantages first of all. What did electronic medical records really aim to solve? What was the problem? I think one of the major problems was intelligibility of the medical records, meaning people's handwriting was getting in the way of making the records more intelligible and understandable to other healthcare providers, sometimes to the provider himself or herself not being able to understand their own handwriting. So there was clearly an information conveyance element to it, and I would venture further to say that that was a safety issue, as unintelligible medical records actually pose a safety concern where you don't understand the information, you can't convey it, and you can actually make medical errors because of that misunderstanding of the records. So the electronic medical records aim to get rid of the handwritten notes and do everything digitally or electronically so everybody could read what was written on the page without any problems. That issue has been addressed somewhat by electronic medical records. We'll take a look at some issues that are actually getting in the way of understanding the electronic medical chart in a moment, but let's just say that readability, as far as just reading the letters on the page, for now, that has not been an issue. That's actually an improvement from the old medical records, the handwritten ones, or what we call the paper charts in the medical profession. Another aspect of medicine that electronic medical records were supposed to improve was conveying information broadly to various providers under the same system or even in different systems. That has been somewhat achieved, especially if you work in the same clinic or in the same medical center or the same medical system. Those medical records are accessible to various care providers, and that can help sometimes in cutting the waiting time of transferring information from one provider to the next. This is not without its downsides, obviously, which I will address in a moment. Another thing that electronic medical records were aiming to do was also cut down on times to get billing information from the healthcare provider to the insurance company. That is something that most electronic medical records actually do efficiently. Putting aside my criticism of the current healthcare system with so-called insurers acting as middlemen between the physician and the patient without adding any benefit, that being said, putting that aside, the actual billing process has been made easier and quicker with the electronic medical records. They transmit the information almost immediately to the insurers for consideration. Another aspect of medicine that electronic medical records were aiming to improve was data safety and security, not only from the hacking or privacy point of view, but also from the actual securing of the data, meaning the data is more sustainable. You can actually save it on the cloud. You can save it at some data storage center. You're not storing it at the clinic. If the clinic burns down and it's all paper charts, obviously that information is lost. The electronic medical record gives you a more sustainable, more robust system to hold on to that data, not without its costs, obviously. Now let's talk about the downsides of electronic medical records, and many physicians and other people engaged in healthcare, such as nurse practitioners and physician assistants, will understand exactly what I'm talking about. So for one, the dream of interoperability of electronic medical records, meaning being able to transfer data from one electronic medical record system to another, that has not been fully realized. I actually think that is a blessing. I don't think we should be able to easily transmit electronic medical records because that cuts into the security, the data security of the electronic medical records. That can be abused by big corporations and by government targeting individuals. That could be misused and abused in a whole slew of different ways. So I think data security with electronic medical records and the interoperability, the fact that they haven't achieved this broad interoperability, is actually a good thing, though many people do not agree with that. Many people want that very fluid, universal system that just communicates between everything. The usability itself of many of these systems, many of these applications, is actually not great. They're not very user-friendly. They're clunky. They take time to load. They take time to transmit. They do have a lot of bottlenecks throughout those applications. I've actually worked with many electronic health record systems, and there is not a single one that does not have a few few quirks that are highly annoying to the people working with the system. And those systems are set in stone pretty much. You cannot work your way around those quirks and bugs. You just have to work with the system, and you're essentially beholden to the system in your workflow at the clinic or wherever it is that you're working in medicine. I've not come across a single physician that has not complained about one element or another of usability or user friendliness of the electronic medical record system. And that translates to frustration, to burnout, and to other issues that eventually affect patients and affect the patient care that that individual is able to provide. They're just taking time away from the patients. They're taking time away from the actual work. Data entry and documentation burden is another aspect of electronic medical record that is highly frustrating. Electronic medical records are very rigid generally. They require certain criteria to be entered, and that is in line with government control and regulation of healthcare. So obviously these things are coming down from the government through the healthcare corporations to the individual practitioner. So there's a lot of data entry that has nothing to do with the visit at hand that the physician or the physician staff has to enter into the electronic medical record, and that takes up a lot of time and resources. So that is another thing that can be highly frustrating and very disruptive to the work, to the point where it actually derails the visit, derails healthcare provision, and derails the actual process of medicine. Electronic medical records are expensive. They cost money. You have to purchase the license to the software. You have to keep on paying the subscription. There is training downtime. The system can sometimes be down due to system updates or other maintenance issues. There are a lot of different hidden costs involved in electronic medical records. And by the way, the electronic medical record software usually takes a cut from the billing application by the physician, meaning if you actually charge a certain fee to the insurance company, the electronic medical records company may actually charge a fee to submit those claims to the insurance company. So there's a lot of costs upfront and on the back end related to electronic medical records. That obviously adds to the overhead for which the physician is not compensated directly. Patient safety concerns. So electronic medical records, if you recall, were about to improve patient safety. That did not work out in a linear fashion, meaning while there are some things about the medical chart, the modern medical record, that is a little bit more understandable as far as just the clarity of the print, that does not mean that the actual record itself is more clear. There are various aspects of the electronic medical record that are highly problematic. For example, the copy and paste phenomenon, meaning the electronic medical record is created by the doctor or the doctor's assistants, and what a lot of people do is they copy and paste the previous visits into the new visits to populate the chart. That blows up the chart and creates what I call chart sclerosis, meaning the charts become inflated with more and more information that is not related to the actual visit at hand. They're just information that was recorded in previous visits, previous incidents, and was just transferred over. So that continues to accumulate in the size, or the proportion of that element of the visit continues to grow and inflate with time. That is very problematic. First of all, for the fact that it's not pertinent to the visit at hand. Second, it does actually create a lot of white noise in reading a chart and understanding what the chart is about with all that nonsense that has nothing to do with the actual visit at hand. That creates a lot of distractions for the physician reviewing the medical record or anybody else trying to make sense of what is going on there. That can certainly lead to, first of all, fatigue and frustration with reading the chart, glossing over pertinent information and actual essential information, and obviously can lead to distractions that can lead to medical errors. We haven't seemed to have been able to make any sort of progress with cutting down on this element of the electronic medical record, and with more information that is not pertinent, that is mandated by the government and by the so-called healthcare insurance carriers to be added to those notes. That adds another element to that chart sclerosis that I'm describing. A highly problematic, and I think probably one of the most dangerous aspects of electronic medical records. With regards to workflow integration, again, the fantasy 20 or 30 years ago was that the electronic medical record would be just integrated into the practice, into the workflow, but that is far from true. And what we see nowadays is that the electronic medical record actually happens to be the bottleneck in many medical interactions in the room while you're trying to enter data, while talking to the patient, trying to really get and enter information into the system as the system is slowing you down because of its own speed and its own quirks and bugs. So there are a lot of different issues with the electronic medical record and the integration into the workflow. In fact, it is not integrated into the workflow as much as it is a stopgap on the workflow, and it can slow down the workflow significantly, sometimes even by minutes, sometimes even by hours, depending on the type of problem that we're experiencing with the electronic medical record. So this is clearly a very serious issue as well. Another problem that not too many people talk about related to electronic medical records, and a problem that many may not see as a problem at all, is that electronic medical record information is said to be used to train artificial intelligence for medical practice. Now, think about it. Forget the fact that physicians enter the data, and it's the patient's data entered by the physician, and that data is taken without clear permission by either the patients or the physicians and being used to train an apparatus or a machine that eventually is thought or is designed and intended to take over the practice of medicine from doctors. Let's just put that aside for a moment. Suppose that that's a great thing. Obviously, I would beg to differ, but suppose that's a great thing. Suppose it's going to be perfect. Look at what the AI is using to train itself. It's using those medical records, those electronic health records that are highly flawed, filled with unnecessary information, filled with copy and paste phenomenon and other chart sclerosis, filled with all these medical errors, on top of medical errors, on top of misinformation, on top of misdocumentation. On top of all of that, and the AI is supposed to sift through that and find out the pertinent and relevant parts and learn how to manage patients that way. That would be one of the worst ways to train anybody in the practice of medicine, let alone something like artificial intelligence with all its other flaws that I've discussed extensively in a video about AI taking over healthcare. So that could be another element, another layer of the disastrous attempt for implementation of artificial intelligence in the practice of medicine. And I would again implore you, tread lightly, use great caution, because the training of artificial intelligence for the practice of medicine, relying on electronic medical records, could go horribly wrong due to the various downsides of the electronic medical records. If you've enjoyed this video, don't forget to hit the subscribe button. Also, don't forget to share and like this video. More great content coming your way right from this channel. Thanks for watching, and God bless.